Can traditional Chinese medicine offer new hope for mesothelioma patients? Could mesothelioma patients benefit from adding herbs and acupuncture to their treatment plan? That is what we will be exploring in the next few minutes. Hey, I'm Deborah from SurvivingMesothelioma.com, and for almost 20 years now, we have been helping mesothelioma patients with the latest in mesothelioma treatment information. In today's video, we are going to explore 3 interesting ways in which traditional Chinese medicine might potentially improve the lives of mesothelioma patients. But first things first, what is traditional Chinese medicine, and how can it help people with mesothelioma? Traditional Chinese medicine, or TCM, is an ancient healing system that includes practices like herbal medicine, acupuncture, and dietary therapies. And after carefully analyzing 3 studies from journals like Scientific Reports and the Journal of Cancer Research and Clinical Oncology, it looks like TCM could potentially help reduce chemotherapy side effects and possibly even improve survival rates. But clinical trials need to be done to see if this will help mesothelioma patients specifically. I'm going to leave a link to all of the studies in the description for you. But how exactly can TCM help mesothelioma patients? Let's take a closer look at the 3 ways that TCM may help. Number 1, reducing chemotherapy side effects. A study published in Scientific Reports in 2017 looked at how non-small cell lung cancer patients were affected by traditional Chinese medicine, TCM, during chemotherapy. They studied 314 patients, which is a pretty good sized group. What they found was really interesting. The patients who used TCM alongside their regular chemotherapy had fewer severe side effects. Now, what does that mean in everyday terms? Well, chemotherapy, while effective against cancer, can be really tough on the body. Patients often experience things like severe nausea and vomiting, extreme fatigue that makes it hard to do daily activities, pain that can be debilitating, hair loss, loss of appetite. But in this study, the patients using TCM had less of these problems. They weren't as sick, they had more energy, and they generally just felt better. And this is huge because it means TCM might make chemotherapy more bearable. Imagine being able to just go through your cancer treatments and still have the energy to play with your grandkids or enjoy a meal with your family, or even just get out of bed without feeling awful. I mean, that could be a real game changer, right? It could mean the difference between just surviving and actually living while you're fighting cancer. All right, number 2, potentially improving survival rates. Now, let's talk about a study published in the Journal of Cancer Research and Clinical Oncology in 2017. This one was even bigger. They looked at data from 111,564 lung cancer patients, and that is a lot of people. And what they found was pretty remarkable. Okay, the patients who were using TCM alongside their standard treatments had a 32% lower risk of dying. I mean, that's like saying if you had 100 patients, 32 more of them might survive if they used TCM. Now, we need to be clear here. This study was done on lung cancer patients, not mesothelioma patients specifically, but it's still exciting because mesothelioma is a type of cancer that affects the lining of the lungs. So there might be some similarities. Think of it like having an extra shield protecting you. Your regular treatments are like your main armor, they're fighting off the cancer. But TCM might be like an additional layer of protection, just helping your body be stronger and more resilient. Could this extra layer of support help mesothelioma patients live longer too? We can't say for sure without more research, but it's certainly an interesting possibility, and it is worth talking to your doctor about. All right, number 3, enhancing overall well-being. Lastly, let's look at a study from the Journal of Liaoning University of Traditional Chinese Medicine in 2010. This one is particularly interesting because it actually focused on mesothelioma patients. The study talked about how TCM principles might help mesothelioma patients by addressing issues like lung depression and blood stasis. Now, these terms might sound a bit strange if you're not familiar with them. So let's just kind of go through and break them down. So, all right, lung depression and TCM doesn't mean feeling sad. It's more about the lungs not functioning at their best. Blood stasis, well, that's about poor circulation. The study suggested that by addressing these issues, TCM could improve a patient's overall condition. In simple terms, it's like tuning up your whole body, not just fighting the cancer. Imagine your body as a car. Western medicine might focus on fixing the broken part, in this case, treating the cancer. But TCM looks at tuning up the whole car, improving your overall health, boosting your energy, helping you sleep better, reducing pain, and generally helping you feel more like yourself. Can you imagine feeling better just overall, even while battling mesothelioma? Being able to enjoy your favorite activities, spending quality time with loved ones, or just feeling more comfortable in your day-to-day life. That is what this approach to TCM is aiming for. Remember, while these studies are promising, they are just the beginning. We need more research, especially on mesothelioma patients specifically, but they give us some interesting possibilities to consider and discuss with our doctors. What I found really interesting is that TCM seems to take a more holistic approach to cancer treatment. It's not just about attacking the cancer cells, but also about supporting the entire body and potentially making standard treatments more effective and tolerable. Not bad, huh? But what about the side effects and the risks of traditional Chinese medicine? The studies we looked at didn't find any major negative outcomes. But one thing they did point out is that TCM is often not standardized. Standardization means the treatments are consistent and they follow set guidelines. So careful management and expert guidance might be needed to achieve full benefits. It's important to note that while these studies showed promising results, they weren't all specifically on mesothelioma patients or in large-scale human trials. Another thing you should take note of is that these studies were a mix of retrospective analyses and clinical observations on lung cancer and mesothelioma patients. Remember, that means they were looking back at what happened, not testing in a controlled environment. That doesn't mean the information is useless. It just means more rigorous clinical trials would be needed to prove TCM's effectiveness for mesothelioma specifically. There can be a big difference between observational studies and carefully controlled experiments. So to recap, here's what we know: that TCM helped reduce chemotherapy side effects, potentially improved survival rates in lung cancer patients, and might enhance overall well-being. But will it work in mesothelioma patients specifically? Unfortunately, we don't know for sure. So what does that mean for you if you have mesothelioma? Well, if I were in your shoes, I would definitely bring this information to my doctor. Maybe TCM could be used as a complementary therapy alongside your main treatment. Maybe it could help you feel better than chemotherapy or boost your overall health. Who knows? But surely it is worth speaking to your doctor about. In my opinion, the research on TCM for cancer is intriguing enough that it is worth having a serious conversation with your healthcare provider about whether it might be right for you. And if you are looking for more information on mesothelioma, please visit survivingmesothelioma.com to see how Paul became the longest living mesothelioma survivor in the world. All right, that's all I've got for you today. If this was helpful, please share it and give the video a thumbs up. I'll see you next time.